Hello and welcome back to my channel. If you've ever had a sudden stomach bug that left you running to the bathroom, dealing with nausea, vomiting, or diarrhea, you might have had experienced something called acute gastroenteritis. It's incredibly common and can affect people of all ages. Today we're going to talk about what causes it, how to recognize the symptoms, when it might become serious, and how it's treated. This video is all about helping you understand what's going on in your body when you come down with this unpleasant illness, and most importantly, how to take care of yourself or your loved ones if it happens. Acute gastroenteritis is an inflammation of the stomach and intestines. It typically comes on quickly and doesn't last very long, usually just a few days. While it's often referred to as the stomach flu, it's not actually related to influenza. Instead, it's caused by an infection, usually viral, but sometimes bacterial or even parasitic. The most common culprits are viruses like norovirus and rotavirus. Norovirus is especially notorious for causing outbreaks in crowded places like cruise ships, schools, or nursing homes. Rotavirus is more common in infants and young children and used to be a major cause of severe diarrhea in kids before routine vaccination became available. Bacterial causes include organisms like E. coli, Salmonella, and Campylobacter. These are often associated with contaminated food or water. Parasites like Giardia can also cause gastroenteritis, especially in areas with poor sanitation or after drinking untreated water. So, how does this illness actually make you feel? The symptoms of acute gastroenteritis usually appear suddenly and can be quite intense. One of the hallmark symptoms is diarrhea, which can range from loose, watery stools to more severe and frequent bowel movements. This often goes hand in hand with abdominal cramps or pain, which can be mild or quite severe. People frequently feel nauseated and may experience vomiting, which contributes to fluid loss. In many cases, people also report fever, headache, muscle aches, and a general feeling of being unwell. The fever is usually low grade, but can be higher with bacterial infections. Some people will notice chills or sweats, especially when the fever is present. Most cases resolve within a few days, but during that time, the constant trips to the bathroom, poor appetite, and fatigue can be exhausting. The body loses fluids and electrolytes rapidly, especially if vomiting and diarrhea are both occurring. That's where the greatest danger lies, not usually in the infection itself, but in the dehydration that can follow. Dehydration is the most serious and common complication of acute gastroenteritis. When your body loses more fluids than it takes in, you begin to experience symptoms like dry mouth, extreme thirst, dark urine, dizziness, and fatigue. In more severe cases, dehydration can cause your heart rate to go up, your blood pressure to drop, and your kidneys to struggle. Young children and the elderly are especially vulnerable. In babies, signs of dehydration may include fewer wet diapers, sunken eyes, a dry tongue, or lethargy. In older adults, dehydration can sneak up quickly, especially if they're already on medications like diuretics or have other health conditions. Another potential complication is the spread of infection. Some bacterial causes of gastroenteritis can invade the bloodstream, particularly in people with weakened immune systems. Additionally, certain strains of E. coli can produce toxins that may damage the kidneys, especially in children. But let's be clear, most cases of gastroenteritis are self-limited. That means they resolve on their own without any need for prescription medication. Still, recognizing red flags is important. So, how do healthcare providers figure out what's causing the illness and whether it's something more serious? Diagnosing acute gastroenteritis is often based on a person's history and symptoms. Your doctor will usually ask about the onset and duration of symptoms, any recent travel, food consumption, or contact with sick individuals. They'll also want to know about your hydration status and whether you're able to keep fluids down. In many cases, no testing is necessary, especially when the symptoms are mild and short-lived. However, if the diarrhea is severe, persistent, bloody, or accompanied by high fever, your doctor may order stool samples to check for bacteria, parasites, or some viruses. In people with underlying health conditions, or in cases where there's a suspected outbreak, further testing might include blood work, imaging, or other specialized studies. For example, if a child is very dehydrated or if a patient has symptoms lasting more than 10 days, more investigation might be needed. Now let's talk about what really matters, how to treat and manage gastroenteritis effectively. The cornerstone of treatment for acute gastroenteritis is hydration. Since so much fluid and electrolytes are lost through vomiting and diarrhea, the number one goal is to replace what's lost. For most people, this means drinking plenty of clear fluids, things like water, broths, or electrolyte solutions. Sports drinks can help, but oral rehydration salts, which are available at most pharmacies, are specifically designed to restore the right balance of sodium, potassium, and glucose. If you're not vomiting, small, frequent sips of fluid can go a long way in preventing dehydration. For children, special pediatric electrolyte solutions are available. If vomiting is present, it's helpful to wait about 30 minutes after the last episode and then begin with small sips, like a teaspoon or two every few minutes, and gradually increase the amount as tolerated. When it comes to food, you don't need to starve yourself, but it's best to stick to bland, easy to digest foods until your stomach settles. The so-called BRAT diet, which stands for bananas, rice, applesauce, and toast, can be helpful, but any simple food that doesn't upset your stomach is usually fine. Avoid fatty, spicy, or heavily seasoned dishes while you're recovering. Medications can sometimes play a role, but they need to be used carefully. Over-the-counter antidiarrheal medications like loperamide can provide relief for adults with non-bloody diarrhea, but they're not recommended for children or people who have bacterial infections, especially if there's a fever or blood in the stool. These medications can actually make some infections worse by slowing the elimination of bacteria from the gut. If a bacterial infection is confirmed and the person is at risk of complications, antibiotics may be prescribed. However, not all bacterial causes require antibiotics. Some can actually get worse with antibiotic use, like certain strains of E. coli. That's why testing and professional guidance are important. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, probiotics, which are supplements containing beneficial bacteria, have been shown in some studies to reduce the duration of symptoms in gastroenteritis. They may be especially helpful after completing a course of antibiotics, which can disrupt the natural balance of gut bacteria. In severe cases, especially when dehydration cannot be managed at home, hospitalization may be necessary. There, fluids and electrolytes can be administered through an intravenous or IV line. This is more common in babies, the elderly, and people with other health conditions who can't tolerate oral fluids or who are rapidly losing fluids. Now, a quick word about prevention, because this illness spreads easily, especially in households, daycare centers, and healthcare settings. Hand washing is absolutely essential. Washing your hands with soap and water, especially after using the bathroom or before preparing food, is one of the best ways to prevent the spread of viruses and bacteria that cause gastroenteritis. Alcohol-based hand sanitizers can help, but they aren't as effective against some viruses like norovirus, so traditional hand washing is best. Always cook food thoroughly, especially meat and eggs. Make sure to wash fruits and vegetables before eating them, and avoid drinking untreated water when camping or traveling. If someone in your household has symptoms, disinfect common surfaces and avoid sharing towels, utensils, or food. In young children, rotavirus vaccination has significantly reduced severe cases of viral gastroenteritis. It's a routine part of the immunization schedule in many countries and can make a big difference in preventing hospitalizations due to dehydration. So there you have it. Acute gastroenteritis is uncomfortable, messy, and disruptive, but in most cases it's short-lived and manageable at home with rest, hydration, and a little TLC. The key is recognizing symptoms early, keeping up with fluids, and knowing when to seek medical attention. Remember, if you or a loved one is unable to stay hydrated, is experiencing high fever, bloody diarrhea, or confusion, it's time to see a doctor. Thank you for watching. As always, take care of yourself and make the most of your day.